Quality of life versus right to die, an ethical dilemma that anyone can face on any given day. This ethical dilemma involves a young 27-year-old woman who has become a quadriplegic as a result of a car accident. She wishes to commit suicide by refusing nutrition. Consider this as I explore this ethical dilemma. Pain is not the only deterrent of any intolerable existence. As a healthcare professional or provider, do you intervene or provide nutrition by inserting a feeding tube? Or do you respect the wishes of this patient? I use the moral model framework as a guide for my ethical decision. Here are some of the things that I consider. Make sure that everyone on the healthcare team understands the desire of the patient. It is important that each healthcare member understands what the patient wants and that everyone is on the same sheet of music. One of the other things I will consider is psychiatric evaluation. Here you could probably assess to see if there's any underlying problems that has precipitated this desire of death. From a legal standpoint, according to the Medical Act of 1988 in Australia, a patient can refuse medical treatment. The Act states it gives protection for criminal and civil liability to the medical practitioner who provides full consent to the competent person refusing medical treatment. This is somewhat similar to the Good Samaritan Act here in the United States. According to the Code of Ethics, the nurse in all professions relationships practices with compassion and respect for the inherent dignity, worth, uniqueness of every individual, unrestricted by consideration of social or economic status, personal attributes, or the nature of a health problem that a person is having. In October of 1997, the state of Oregon passed the Death with Dignity Act. It allows adult residents that are terminally ill to self-administer lethal doses of medication prescribed by their doctors for the purpose of ending their life. They have the right to decide the quality of their life and have been given the right to die. To die is a personal decision. Me as the nurse, I must respect that, and I have come to understand that and appreciate that. So as I said before, someday you will be faced or you may not be faced. But if you are, it is your right to decide what your quality of life should be.